Thank you. It's a pleasure to be here. Be patient with my English, my foreign language. I'm Italian and I work in Barcelona. And I'm here, I'm a neuropsychiatrist for child, I'm an adolescent and a psychotherapist. And I'm here to talk, try to have a really overview about this approach, this mentalized-based treatment for children. And you have to know that this kind of treatment is not new. It's an integration of clinical and developmental psychology. Here there are a lot of my mentor and author of reference. And we do talk about research and attachment research and child psychoanalysis. And I start to work with children when I arrived in Barcelona and with the MBTC limited approach. And I met my colleague Norca Marbet, and we was approaching with different from different land, and we start to work together to make this approach adapted to the autism. And we just came out with our first training, and we are on track for the first manual, okay, for next year. And as I said, we came from different land. And I work with group, I work with individual, and we and my colleague, we give this new dimensional approach that came, that give evidence of the inner world thanks to the using of the psychodynamic diagnostic method, integrating with the categorical approach. And this new what is important for us is really important, this bidirectional responsibility to understand, respect, and integrate the other perspective with our posture, how we met the other, what we call epistemic trust and epistemic justice. And this is a really dense slide, but this is the result of my first year of clinical research. It's a pilot open trial that I organized, which you have to know that mentalized-based treatment is based on level, and we work on block, okay? And we start to work on with the same narrative, with family and environment, improving affective function, but we work on the base and the attention regulation, improving secure attachment. We work after the functional diagnosis, we have to work in different points, like in attention regulation, we have different goals. Then we go, we co-activate and we regulate after affective regulation. Then we give a simply word to the inner world, and then we improve what is the symbolism and what we call theory of mind, affective and cognitive, but not only because we work with this shared and social ability, and we work at the same time with the same narrative with all the environment. So what happened? We improve what we call the coherence of self and the body self thanks to activating specific neural circuit. So when this happened, this match happened when we have a really clear level of arousal, that the emergencies of this kind of learning, this kind of bidirectional learning that go in 3 different steps, appear in this kind of in this level of arousal. You have to understand that my posture as a clinician and as a researcher was, okay, what is happening when I'm thinking, when I'm giving you my idea, when I'm working with you, when I'm, there is my mental state attribution, there is my reflective function, and I'm interested in what is where is the co-activation and the overlapping of this network, because this is the secret of the change in therapy. This is the secret of flexibility. So this is the model that we hypothesized. So we have different actors, we have different neural circuits that are integrating and they are connected, and they are working to a progressive autonomy and agency of the subject and the child in my job, and to control, and we give more improve social learning and cognition. So the question is, what I can do to improve this treatment, and how can I understand more in deep which are these neurocircuits and how they are overlapped, they are correlated because how they are dependent, they are independent, they are correlated. So my sample are children between 5 and 9. And is a specific target with, I work with every kind of psychopathology, but I study research with, for simplify my life, and with IQ and above 85 and verbal communication and their parents. So I'm trying to integrate different lens, and these are my reference. And one, I was here to make children. And the integration and the connection is the key of the creativity. And I hope that we are going through really toward the developmental neuroscience of natural behavior, because we need to understand that it's important to interconnect the concept about synchrony, interbrain communication, the neuroscience of two, the flexibility, and all the study about brain dynamics that interconnect and then give more understanding about body connection. So there are colleagues that have been working on that, and they are giving model about this kind of interconnection. That is an incredible work about my Ilenia Gordon from Israel. And so in brief, this is 2 minutes. Yes. Okay. And there is a really bad gap in this fight. There is no research in this kind of with this population, and I don't go in the deep, but there is only one study that talks about children, that is the Richardson and colleagues, that give an evidence about experimental paradigm, and they use not only they use that with children, the listening story, at the same time give different mental state attribution. And about functional activation, I want to point out that there is a stable partner that is given to the theory of mind, but I'm interested in one partner that is reduced, the right temporal parietal junction, because is an important self attribution function. And there is about functional connectivity. There is no a consensus about the functional connectivity, so maybe this is one of the future promising biomarker research. And why is important for me as a clinician? Because I need to work in this continuum dynamic dimensional perspective that is personalized, and we give this individualized treatment. And there is evidence that working on the block on the giving possibility to cognitive affective understanding is important. And as well, this is the Fulmore network is something that they say is an inner mentalized network, because when we work in explicit mentalized, and this overlapping is okay. We are working on speech, we are working on communication, we are working improving sense of self, and we are working in a spatial environment. So it's important always to understand that with children there is not an effect of age in the social brain, but they use there are regions that are implicated in attention and executive control that are more important than the social brain. So when I direct my therapy is the focus. And at last, we explore the developmental change is in this mental state representation is fundamental. Okay, so to deeply understand the treatment change, is important to have more research in task-based related linked to this kind of therapy. There is an intersectionality and dimensionality due to the primary concept and the difficult conceptualizing of this concept, and the overlapping, as I say, is the territorial change. And it's important to open the research to the synchrony and extrinsic process linked to relation and social environment. So the limitation is the age and the child-friendly task that we have to capture. And to investigate, it's necessary to investigate different neurophenotype. In particular, connectivity and connective memory are important due to heterogeneity. So I hope to advance a new understanding of the complex nature of interplay of brain behavior association within complex DID process. And I hope to integrate in different but conceptually related image, we can improve treatment outcomes.